This is the Ventilator Circuit Change by Courtney Hernandez, assisted by Jessica Navarro, and filmed and narrated by Brent Charles. And action. So the first thing the RT is going to do when changing a vent circuit is gather equipment.
Okay, I brought my HME, my filter, and my circuit.
So the next thing the RT is going to do is maintain a sepsis by washing her hands
Wash, wash, wash.
and gloving up.
Glove, glove, glove.
Okay, so the next thing the RT is going to do when changing a vent circuit is assess the patient.
Okay. I'm checking for the skin color. Skin color is fine. Breathing well. No
Coming
cyanosis.
out, and then this will be what comes out. You know what I mean?
Good saturation. Good heart rate. Everything's
Okay.
good.
Next thing the RT is going to do is empty condensate out of the tubing. But because there is an HME on this tubing and on the prior tubing that was being changed, there will be no condensate that we need to change. So the next thing the RT is going to do is suction the patient. But because of this ET tube, we can't add a suction catheter onto it. But on a normal circuit, there would be a side connection for suctioning for a closed circuit ballard that we could suction the patient to remove any kind of secretions that may have developed. The next thing the RT is going to do is prepare the new circuit.
Okay. I'm going to attach the HME to the new circuit. Like so. Okay.
So after the RT prepares the circuit, she is going to replace the humidifiers.
So
Okay.
we're not gonna use it.
Okay, I'm going to put it, silence the alarm for a second so I can change it.
So while the RT is changing the circuit, her assistant, Jessica Navarro, is going to be bagging the patient to keep oxygenation of the baby.
And then I'm going to put this on standby. So it stops alarming. Okay, then I'm going to go ahead and detach the circuit, the old circuit. And I'm going to toss it. We don't need that anymore. Grab the new circuit with the new HME and attach.
No, we're not turning it on. Okay, no problem.
Okay, and then I'm going to take it off of standby. And we're going to attach.
Before the RT attaches the circuit to the patient, the RT is going to test and see if the circuit is actually working again to verify that when connection is replaced to the ET tube that the air is actually coming out.
Yes, no leaks noted.
Okay. And so the
Okay, you
RT
ready?
connects the patient. And it is seamless.
Okay, that's it.
So after the RT reconnects the new circuit, the RT is going to reassess the patient to see if the patient is in distress or any other kind of problem has occurred.
I see equal bilateral chest rise. Breathing good. Good sats. Everything's good.
And as well, the RT would also auscultate the chest to see if the ET tube slid down to make sure that there's equal breath sounds.
Excuse me. sounds good. I hear air flowing through those lungs.
Okay. So after the RT reassesses the patient, the RT is going to monitor the ventilator parameters. And assuming that they are all okay, the RT is going to document all information on the patient's record and double check the patient is ventilating well and assessing the patient, and then exit the room.
Okay. Patient's doing fine.
All right, so the RT, after the circuit change is complete, the RT will maintain asepsis by removing her gloves and throwing them away in the trash can and washing her hands before she leaves the room.
There we go.
Again,
Fill out.
thank you for watching our video. Hope you enjoyed it. See you later.